Good morning, CHD. Welcome to Pediatric Perspectives, where we're looking at children's health challenges from a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. And boy, do I have a truth teller with us today. My guest today is none other than Dr. Peter McCullough. Welcome, Peter.
Paul, great to be back with you and the Children's Health Defense audience. So much to cover. So I know we've got a packed agenda.
We'll jump right in. You are originally an internist, cardiologist, epidemiologist. You've published over 1,000 articles, reviewed thousands and thousands. You are a world expert on COVID. And for me, honestly, you are the most brilliant physician I've ever met, ever listened to. You have the ability to just understand and be able to share and teach in a way that I've never seen before. You had that landmark article in 2020. I mean, we got hit with COVID and none of us knew what to do. And you published pathophysiological basis and rationale for early outpatient treatment of SARS-CoV-2. That really established the first life-saving protocol. And thank you. I mean, you're not just brilliant in your expertise, but you still take care of patients, which is pretty unusual.
Well, thanks so much for those comments. I'm deeply humbled. But, you know, here we are 5 years into the pandemic, Paul. Isn't it astonishing that Harvard never laid claim to an early outpatient treatment protocol, or Mayo Clinic or Cleveland Clinic or any of the universities? I mean, this was the biggest opportunity in academic medicine for some center to claim an innovative approach and actually do it.
Right.
Do you know no hospital to this day claims to be a center of excellence for the inpatient treatment of COVID?
Correct.
This is the biggest problem that humanity's ever tackled. And I was on a podcast in Germany yesterday, and I said, you know, the brilliant German hospitals, not a single one of them claims to have, you know, particular expertise in COVID.
Right. And you used to do hospital-based work, did you not?
Sure. I was, inpatient rounder on both cardiology and internal medicine. Now it's an academic setting. So we had residents and fellows, and I, ran two clinics, one, a private clinic, and then one where I supervised the residents. And, I was astonished in 2020 when no single center asserted leadership in the pandemic. It's not like we could look to one center and say, wow, they are really paving the way. They are preventing hospitalizations and deaths. They essentially shrank and they stepped back and they looked for government protocols from the National Institutes of Health or the Infectious Disease Society of America, IDSA, which mirrored NIH. And, they only addressed the inpatient setting.
It has to be frustrating. You have put together, the initial protocol. I'm sure you've fine-tuned it since then. And what's your experience been with treating even the very sick who had COVID, even the high-risk elderly? What was your outcome experience in contrast to what was going on in hospitals?
Over time, initially we did it remotely by phone and then in person. I can tell you the physical exam of a patient with COVID, the pulmonary exam, is very different than any other pulmonary exam. It doesn't sound like lobar pneumonia or heart failure. Do you know many infectious disease doctors to this day have actually never examined a COVID patient because they've only done remote work on inpatients. And there's no infectious disease doctor in America who claims to use an early multi-drug treatment protocol to treat COVID-19. So under direct observation, now I've treated thousands of patients, and the McCullough protocol clearly is associated with reduced intensity and severity of symptoms. And we've published comparative data in Dallas-Fort Worth area, a big study, myself as first author. And And it's associated with about an 85% reduction in hospitalization and death. And that's what people wanted. Everyone got COVID. 97% of people got COVID.
Right.
So everyone was going to get the illness. The whole issue was to avoid hospitalization and death. So McCullough protocol, as of today, the principles have been attributed to saving tens of millions of lives and sparing hundreds of millions of hospitalizations. The most rewarding thing I've done in my career.
Yep. And thank you for that. And where can people go? We may have doctors who are listening in who aren't implementing or aware of where to get your protocol. So where do people go to get that?
They can go to petermcculloughmd.com. The McCullough protocol is the base of the Association of American Physicians and Surgeons Home Treatment Guide. McCullough protocol is, again, the most widely cited and searched for protocol on the internet. Simply can Google search it. And, it starts with simple things like opening the windows, getting fresh air, using nasal sprays and gargles. That's something that our academic medical centers never mention, despite dozens of trials, even inpatient trials. The use of over-the-counter nutraceuticals and supplements, and then into the oral antivirals, corticosteroids, anti-inflammatories, and antithrombotics for severe cases. Now, there are very few severe cases. In my experience, virtually no one needs treatment now because natural immunity is present in 97% of us, and the virus is mutated to such a milder form. But occasionally, we'll have a patient who needs early treatment. Sadly, I had a patient severely immunocompromised, never had COVID before, and she actually contracted it in December, and she died here in Texas within 36 hours. So it still can be a serious infection.
Right. I had not realized that natural immunity was up to 97%. That is incredible. Speak to the issue of the vaccine for COVID, if you even want to call it a vaccine. I remember reading the Cleveland Clinic data that was very powerful. The more shots you got, the more likely you were to get COVID. Speak to that and whether or not this 97% natural immunity is because of the vaccine or because of the fact that we've all had COVID.
No, I think we've all had COVID. So there have been very good estimates. Even by the end of 2022, our CDC had an estimate they put out as a press release that 78% of the population by the end of 2022 had COVID. So now we're into 2025. It's about 97%. That's what I observe in my clinic, Paul. I measure antibodies against the nucleocapsid and the spike protein. I mean, there's no antibodies against either one. That's somebody who's never experienced the virus. If there's none against nucleocapsid, and it's about 3% of my population, so I think it fits. The COVID-19 vaccine campaign, I think, will go down as the largest biopharmaceutical debacle in human history. I published an op-ed in August of 2020 in The Hill, and the title of it was called The Great Gamble of the COVID-19 Vaccine Development Program. I was at Baylor at the time. Scott Atlas was at Stanford. We were the two doctors invited to write op-eds that were read by the White House, the U.S. House of Representatives, and the Senate. And I called it out in August of 2020, 4 months before the vaccines went on the market, that this was a gamble. And because the vaccines were novel, genetic, I thought, honestly, they just weren't going to work. I was really focusing on efficacy. And boy, when we started to see the safety data as they came out, Pfizer within 90 days recorded 1,223 vaccine deaths. This is stunning. And Pfizer tried to cover it up, and the FDA tried to cover it up, and it came out a year or two later.
So why is this vaccine on the childhood schedule starting at 6 months of age?
It was a grave error by the ACIP panel, the CDC panel that decides childhood vaccines. Now, if the vaccines were safe and effective, the group that would need them would be senior citizens in nursing homes, senior homes, those in congregate living, patients, older, obese, diabetic, heart failure, kidney failure. I was in 2020 a co-principal investigator of a COVID vaccine program proposed to Operation Warp Speed. It was with the Imodulon vaccine, a novel cellular-based vaccine. And so when I proposed this to the CDC, NIH, and FDA, I outlined at the most 2.7 million Americans should receive a vaccine. And under no circumstances would a healthy young people or mid-age adults like us or children ever receive a vaccine. I went on Fox News and said this. And now, as we sit here today, there's been an ultra focus on children. It's on the schedule. Nick Hulsher at McCullough Foundation has reported through data sources that 9 million out of our 70 million children last year received a COVID booster. And in Brazil, they are mandatorily vaccinating all 6-month-old babies. And if the parents refuse, the parents get, Paul, basically what's a $30,000 US fine, or they get put in jail. And there's been surveys of the Brazilian judges, and they all believe this is existential to the health of Brazil.
Wow. Yeah, the vaccine industry is heavy in Brazil.
Well, Paul, listen, my mom is in a senior home in Dallas. And let me tell you what, she didn't take the vaccine to begin with, and she warned others about it. And let me tell you, my mom's a talker. You can't get her to stop. And you know what? They have not even brought out or discussed COVID vaccination for years in a very large senior facility. So if they're not vaccinating senior citizens or even offering it, what in the world is it doing on the childhood schedule?
Right. Especially, I mean, kids got COVID and hardly got sick. So that 97% immunity, I'm sure, exists for children. And they absolutely don't need it. And it's basically all harm and no benefit.
That's true. And, you know, there have been hundreds of children who have died directly after COVID-19 vaccine. We should never have any deaths due to any vaccine. A single death would be absolutely unacceptable. We know that their bodies are being loaded with the harmful and disease-promoting and dangerous spike protein. There's no way to shut off the messenger RNA. Remember, only Pfizer and Moderna are emergency use licensed for children. So even to this day, the boosters don't have full agency approval. They were ushered on the market just with animal data. They're not even appropriately pediatric dosed for children. And now we have grave concerns regarding cardiac, neurologic, immunologic, thrombotic complications, and maybe in the future, actually increased risk of cancer.
Yeah, I have no doubt about that. So how do we get this off of the childhood schedule? Do you have any thoughts on that?
Not a single country in the world has addressed this. This is stunning. Not a single country in the world has pulled the vaccines off the market. The voters made their voices clear. They voted for Donald Trump, I think in large part because Robert F. Kennedy joined him. So now we have Robert F. Kennedy in office, and they're still not off the schedule. You know, whether by executive order, a HHS order, this could have been done January 21st.
I agree. I hope it happens soon. It hurts my heart to think of all these babies and young children being just sacrificed for no reason at all. I'd like to pivot to spike protein, because if you might speak on the issue of shedding and the fact that we're not done yet with the dangers of spike protein, and how I know you've come up with some really good ideas. You've published on this. You've got the clinical rationale for SARS-CoV-2 based spike protein detoxification, your article. I consider you an expert in the world on this. Talk a little bit about that.
We've learned so much. You know, all the agencies now, FBI, National Security Agency, CIA, they all agree the virus was engineered in the Wuhan Institute of Virology. Here's the virus here. It kind of matches the CHD TV logo. You can put it right here. Same green, Paul. The spike protein is on the surface of the virus. This is what was engineered in the Wuhan Institute of Virology. It's about 1,200 amino acids. It's coded by about 3,800 base pairs. And it directly docks with human receptors, ACE2 and TMPRSS2 receptors. The virus injects itself into the body and then replicates. Now, if you've had the natural infection, just the tip of the spike protein stays in the body. It's called the S1 segment. Bruce Patterson has shown that it stays in the body at least 1.5 years just with COVID infection, no vaccine.
Wow.
Okay, so this is important. Now, the full-length spike protein is held open in the pre-fusion conformation with Pfizer and Moderna due to 2 proline inserts. By the way, they kind of copied each other on that. And the full-length spike protein is circulating in the blood of the vaccinated, and it twists into groups of 3, trimerizes, at least for 9 months, maybe longer. A paper by Brognas showed 6 months by mass spec, and then another one from Yale showed it 709 days. Now, importantly, in both those studies, it was not everybody who got the vaccine, Paul. In Brogna, it was about 50% of the vaccinated had circulating spike. And in the Yale paper, it was about a third. So there are some people who take the shots that are either rapidly clearing the spike protein out of the body, or they didn't get much messenger RNA at all. In my practice, I measure the antibodies to the spike protein, and we use the Roche Alexis system. There, if someone's had the natural infection and just the tip, the antibodies against the spike protein are typically less than 1,000 units per ml. But if they're vaccinated and or had COVID or both, they can be 5, 10, 15, 25,000 or more units per ml antibodies against the spike protein. Has been my experience. People at 5, 10, 15, 20,000, they're sick. And so they have evidence of spike protein disease in their bodies. So it's a strong rationale that we ought to do something to get rid of the spike protein.
Yeah. Are you finding that the spike protein in the people who say got vaccinated, that half or 2/3 who don't have spike protein, that they don't have antibodies either, or they're just lower?
They're lower. So remember, the antibodies lag the spike protein maybe by 6 or 9 months or so. And the antibodies are a immune memory. So, they could persist for years, but we know with a natural infection, they drop off pretty quickly. We knew that with the SARS-1 infection. What I infer is when the antibodies drop, for sure, the mass of spike protein must be reduced in the body. And I look for about a 20% drop. We know under 1,000 units per ml, every study shows that's low risk. In fact, we have a peer-reviewed publication in the World Journal of Cardiology on that. So the under 1,000 is really good news. 20% drop. And now, there are assays emerging to directly measure spike in people. This is terrifying. But Yale has the SPEAR assay, still research. Brogna can do mass spec. And now a lab in Germany is offering this. If people want to send their samples, and the lab is called INMODIA, INMODIA. So I've sent some patients there. We're going to quickly shift from measuring antibodies to the spike to directly measure spike in blood and in body fluids and tissue.
What symptoms would clue somebody that they probably ought to reach out to you or to somebody who can figure out if they are indeed suffering from spike problems?
Well, let me tell you, it's so disconcerting to know. A paper by Crossan and colleagues found both Pfizer and Moderna messenger RNA and spike protein in the human heart. It's physically in the heart. No wonder patients have chest pain, palpitations, swings in blood pressure. Recent paper from Japan found the spike protein in the lining around the brain, the meninges. So it's in all the tissues that we can imagine. An autopsy paper from the NIH by Chertow and colleagues, people who died of COVID, they found the spike protein and the virus at low levels in every tissue: the eyes, the skin, the lungs, heart, liver, spleen, kidneys, reproductive organs. Paul, it's essentially everywhere. So no wonder people have symptoms, long COVID symptoms. So post-exertional malaise, headache, loss of mental clarity or brain fog, chest pain, palpitations, swings in blood pressure, numbness and tingling, what's called a small fiber neuropathy, obvious blood clots in the arteries and veins, loss of vision, loss of hearing, loss of taste of smell. All of these have been reported, autoimmune conditions. So, at this point in time, Paul, I'm telling patients, listen, if they were perfectly healthy before the pandemic, and now it's 5 years and something is wrong, it's almost certainly due to the spike protein.
Yeah.
I mean, think about it. What else could have changed? Let's take an unvaccinated person. They're perfectly healthy. Now we go through the pandemic and they don't feel well, sleep disturbance, headache, visual disturbances, numbness and tingling. What else is there? And if we do the antibodies against the spike protein, invariably we'll find them high. Somebody who took the vaccine, I mean, the FDA agrees it causes myocarditis or heart damage. So anybody who took the vaccine who has chest pain, palpitations, difficulty breathing, these are symptoms of what's called subclinical vaccine myocarditis. And I put that in the chart. Clinical myocarditis is form fruste. Patients have chest pain, dramatic EKG changes, huge elevations in cardiac troponin, a blood test for heart damage, and they're admitted with heart failure and arrhythmias. That occurs in a week or so. That's terrifying. That's absolutely terrifying. But there's a bigger penumbra of patients that have subclinical vaccine myopericarditis. And now a recent paper, again from Japan and JCC, one of our best journals, cardiology. You know what it shows, Paul? It shows micro scars in the heart from the vaccine.
Wow. I remember you talked about listening to the lungs of COVID patients. What were you hearing? What did it sound like?
It doesn't sound like the wet rowels of heart failure, and it doesn't sound like the dry crackles of pulmonary fibrosis. It's a very dense sound. It's a dense kind of popping sound. And I've examined patients several times. I could pick it out in a lineup tomorrow.
Wow.
And it's very interesting, and it's different than influenza. Influenza doesn't cause much pneumonitis. When people get sick with influenza, it's because of a lobar pneumonia. And we're seeing that now with these measles cases in West Texas. It's really a pneumonia, bacterial pneumonia process, and not the virus itself.
Yep. Okay. That fits with my understanding. So, can people get tested for spike, and how do they do that? Do they contact your clinic or office, or how does that happen?
Well, listen, LabCorp and Quest both offer the spike antibody test. Now, Quest limits it up to 2,500 units, and that's not useful enough. LabCorp extends it to 25,000, and they use the Roche Alexis system. So I think patients should go to their doctor and just demand it and say, listen, I felt sick. I want to get an inference on how much spike. Order the LabCorp extended range assay. I'll shoot you a little graphic. LabCorp, this is one of the most popular tests. They've actually made a graphic of exactly what CPT code and LabCorp order number it is for this test.
Perfect. And then now to wrap up this session, how do people deal with spike? Like how can we get it out of our system?
Well, let me say none of our traditional drugs that we've used to treat COVID actually physically get spike out. So hydroxychloroquine doesn't do it, or ivermectin doesn't do it. People have tried low-dose naltrexone, vitamin C, nicotine. Not that those are not useful adjuncts, but the core treatment is to get rid of the spike protein. That's McCullough protocol-based spike protein detoxification. That's the combined use of nattokinase, an enzyme, bromelain, a family of enzymes, and then curcumin, an anti-inflammatory. I want people to know every day they should do a twice daily nasal spray and gargle. Preventively. Don't wait until you're sick. Anything from saline to xylitol or dilute iodine-based, colloidal silver-based products are fine, but do it twice a day preventively, because the virus is in the nose about 5 days before the initial sore throat. So you have to use the nasal spray, preventively and gargle. That's going to cut down the whole burden of these illnesses dramatically, probably prevents common cold, influenza, and COVID based on the clinical trials. I am seeing brand new blood clots and cardiovascular problems now 4 years after the shots in 2021. And I'm finding evidence that the spike protein is not getting out of the body unless they do detoxification. Now, after a year of detoxification, patients are gratified. Their spike levels are down in the body. They feel better. And it's a wonderful thing. I've never had a patient develop a new blood clot or a new cardiac problem once they've started detoxification. There are additional useful drugs, Paul. Colchicine, mandatory for the myopericarditis at any level. Ivermectin is useful for the craniofacial, pulmonary, or skin rash syndromes. Hydroxychloroquine, useful for the autoimmune syndromes. Supplemental nicotine, useful for the neurologic symptoms. Follow me at my website, petermcculloughmd.com. Focal Points, Substack, McCullough Report podcast. And of course, every time I can get on CHD TV. So thanks for having me on.
Wonderful. Thank you, Dr. McCullough. Brilliant. We're going to get you back, and we're going to dive into pediatric issues and some other things. So thanks so much. Folks, you can also follow me at kidsfirstforever.com, and I look forward to seeing you next week.
My son's name is Banks, and this is never in a position that I wanted to be in to discuss. I never thought I would be in this place, but I have 5 children. My son Banks is the third. My first 2 children were vaccinated normally on the traditional schedule. Banks, the third one that was born, every time we took him to the doctor, we held our breath. First of all, when I was pregnant with him, I had a friend whose son died of a vaccine injury, so I went to the funeral, and I knew not to give this child vaccines, but I thought I was being a good mother by delaying the vaccines, so we delayed them. And every time we went to give this child vaccines, we held our breath and thought we were doing the right thing. The pediatrician finally told us that we should go to the health department to get fresher vaccines, which was, now we know, is a joke. So
what do they mean by fresher? What does that mean?
They said that I was so worried about thimerosal, and I was so worried about shots that had thimerosal in them, and they told me that the health department would have fresher vaccines, that we wouldn't have to worry about that. So I took them to the local health department in Tennessee, and the nurse there was a friend of mine that I went to high school, a friend of mine's mother who I went to high school with, and she told me, your child is obviously over 3 years old. He's not autistic. You're crazy to worry about vaccines. You need to do this. You're not being
responsible.
You're being very, your child needs vaccines. You're not being a good parent because you're not vaccinating your child. You're hurting them. So we did it. And he got the MMR, the DTaP, and the HEP all on the same day. The next day, he couldn't walk, he couldn't talk. This child who was so verbal and potty trained so early and just an absolute rock star was gone. Freaking gone the next day. Gone. We rushed him to the emergency room. What's wrong with him? What's wrong with him? Oh, he's epileptic. You just didn't realize it. And no, he wasn't. Everywhere we went, and I knew it was the vaccines. The doctors that we went to, they kept telling us over and over that we just didn't realize it was there, that you just didn't pay enough attention to him, you just didn't realize it. I lost my train of thought.
Well, talk about the actual injuries your son had. I mean, what were we talking about? You're talking about you had a lively, happy 3-year-old.
I had a wonderful, lively 3-year-old who was bouncing around and so verbal and talking and just beautiful, beautiful skin, beautiful eye contact. Let me back up a little bit. He did not have beautiful skin. I'm wrong about that. When I was pregnant with this child, every doctor, well, not every doctor, the doctor that I was seeing, I was on antidepressants. I had yeast infections. I had strep throat. I had all kinds of stuff. I was on major antibiotics when I was pregnant with him. And then I would go on to yeast infection medicine. And then he was induced. And then I had 10 ultrasounds with this child. It was a perfect storm. Then when he was born, he had ear infections, and he was on antibiotics, and he was on antivirals for yeast infections and all this stuff. And he had yeast around his neck, and then he had eczema, and they kept giving him vaccines, and they kept giving him vaccines, and nobody ever said to me, don't, gluten-free diet, or don't vaccinate him. These were all red flags. Then when he was just after the time that he had, right before the time he had the vaccines, he got scarlet fever, which is very, very, he had strep throat so many times that it turned into scarlet fever. And this is all the perfect storm that happened, and then he was injected with the vaccine, and that's when he was gone.
For everybody who thinks, and possibly for those people that have watched Vax, that think, oh well, I'll be safe if I vaccinate 3 years and over, you're not. And we're hearing this so much, really way more than we want to hear it, that it doesn't seem to matter what age your child is. If they can't cope with the onslaught, they can't cope, which is clearly what happened to Banks.
No, I tried that. I thought that was what I was supposed to do. I thought that I was supposed to, I listened to Dr. Sears, and I laid it out, and I did a delayed thing, and I was just delaying the inevitable. I was just delaying what was going to happen. And now, fast forward to what we have now, we have a child that we spend more money than we can afford on treatments and chelation, and we got a mess. We have a child that's never going to survive on his own, and we don't know what we're going to do. about his future. I mean, so you give birth to children, you expect that you're going to raise them, and then they're going to be 18 years old, and then they're going to go off on their own. And now we have a child that's never going to leave us. And it's all because I thought I was doing the great thing of delaying. Let me back up to the health department and where I thought I got the fresher vaccines. I researched the vaccines, and they had thimerosal in them because the health department that we went to bought discounted vaccines. So it's not illegal to buy vaccines that were manufactured before they did the thimerosal. It's illegal to manufacture them anymore. So he got a dirty vaccine. His MMR was dirty.
Did at any point they acknowledge that?
Never.
How did you know then? How did you find that out?
That what?
The MMR, the vaccines were dirty.
Because I went to the health department and I said, give me the lot number of the vaccine that he had. And they gave me the lot number, and I researched it on my own, and I saw when it was manufactured. It was manufactured back when they still did the when they put thimerosal in them, because it's that easy to research. It was that easy. It's probably not that easy to research now, but it was that easy to research then. It showed the manufacture date.
It wasn't just the MMR anyway. He had DTaP.
He had a fatal combination that day. Right. Nobody should ever have an MMR and a DTaP and a hip on the same day, ever.
So how old is he now?
He's 8.
Was this injury ever reported to the VAERS program?
No, because I was told I tried to contact lawyers. By the time I wrapped my head around it, the time had ran out. And I could never find a lawyer to help me. I could never find a doctor to acknowledge that he did it. I mean, that's what happened to him. And I gave up. I was too concentrated on saving my son. I just couldn't. Everybody kept telling me it's an uphill battle. Don't even mess with it.
So he's 8 years old now.
Mm-hmm.
And he's doing... What are the consequences of what's happened to him? What are we dealing with now because of these vaccines?
He's an 8-year-old boy who goes to school with an assistant all day long because we're very fortunate enough to be able to pay for that. We pay for him to have an ABA with him every day that stays with him 24 hours a day. He goes to a small private school because the county that we're in wants him in a self-contained classroom that has very severe autistic kids, and he was running away from school, and he was going half a mile away from school, and we were having to put tracking devices in his pocket to find him, and he was hiding behind buildings. So we pulled him out and put him in a small private school, and we pay for a shadow to go to school with him every day, and we also pay for a teacher with a master's degree to modify the program for him so he can learn. But it's a freaking mess. It's just a mess. We've got a Band-Aid on it right now, and it's not working, and it's not helping.
Billy, literally 2 minutes, I promise.
We can stop if you want to.
Just 2 minutes. You know, he just says no more, and you know what? He's right. We don't want to hear anything.
I understand that. He hears a lot.
We want to hear you. We want to hear everybody, but
no, I get
he's
it.
Right.
I don't want to hear it anymore either. I don't want to be sitting here doing
what
this.
He's saying is that he's been with us 2 days, and all he's heard is the same.
I
thing
know,
over
and I feel
again.
the same way. That's how I feel with my life. I don't want to hear it anymore either.
Your story is so important, and we want to make sure you and I stay in close contact. We've already made that bond already, because you're exhausted, utterly exhausted, and it's just a long journey. But you're also a really amazing person, and we need you in this fight. So don't give up, please. We need you. We'll support you.
That's the problem, is you feel like giving up every day because I don't feel like it's getting any better. And it just, no matter how many therapies and how much I try, it never gets better. And I feel so responsible because I knew every single time I took him in to get a shot that it wasn't working. And I knew especially the very last time I took him in that was the one that did it. And I'm the one that was alone and did it that day. And I will never ever forgive myself for that.
And you're not alone in thinking that, and you're not alone in your exhaustion, and everything you're going through. All of us go through this, but please know that that we need you in our fight, okay? You're here to stay. We got your back.
But once again, this is not. I thought I would just be an advocate for something else. I never thought I'd be thrusted into this one, but I'm here, and I guess this is where I need to be. But it's a very painful place to be. It's an extremely painful place to be when you have children that you just can't fix. And I feel very responsible that I did it, and I can't fix it. I feel like I did it, and I can't reverse it. I drove him there that day. I did it. I signed the stupid paper and did it, and I can't take it back. And I will never forgive myself for that. And I go to therapy every Tuesday, and it's still not working.
Yeah, it's painful. It's painful. I'm not going to say to you to take that guilt away, because we all know
The
deep
guilt
down,
keeps me fighting, though.
Right.
So it's a very
right. And we all know it's not your fault any more than it was my fault or anybody's fault. We just did what we thought was right for our kids at the time. So, now, Kim, I know, is a friend of yours. Now, she is a rocking mama.
right.
So she's going to hold your hand right here, but we're going to hold your hand around the country.
I feel that.
And
Thank you.
you're going to go to Autism 1
I am.
next year.
You gonna go with me?
I think I probably will. Yeah, I think I probably will. And there's loads of other places that you need to go to, and Austin being one of them. Come see us.
I'm excited about that.
And yeah, you're getting a load of love and hearts and hugs, and you should sign on to this Periscope thing.
I need to figure that
Then
out.
you will know that you're not alone, because this is one big family.
I need to figure that out.
Literally, we're all here just protecting each other. And if you want to see this, look, check it out. Those hearts.
See, I don't understand that. That's so cool.
See all those hearts going
Yeah, I
up?
do understand that.
They're
Yeah, that's
tapping.
another
They're
thing.
tapping. They're saying they're sorry and they love you. They're
That is so
tapping.
cool.
They're tapping the screen with hearts for you, because they're trying to show you love, and that's how we
Yeah,
show
I've
each
gotta
other
figure
love.
this out. That's so sweet.
So once you see, look, you're loved. We love you. They're all saying love you. We love you. God bless. This is your new family. Okay, right? Got it? And these people have been through the same pain you've been through. Okay, so I'm going to get Anu to set you up on this
I
Periscope.
don't like ugly crying. It's not pretty.
You're going to join. No, everybody cries, so it's fine. And you're going to join us, okay? All right.